One with Better Spaces. We partner with buildings and companies to create programs to help you connect, create, and perform at your highest potential. Today's session is shoulder mobility drills for tennis. And Dr. Paul Cachola received his doctorate of physical therapy from Mercy College and a BS in exercise physiology from Rutgers University. His treatment philosophy is move better, feel better, and play better. Delia, if you have a question, feel free to unmute yourself and ask, since we got a pretty small group, or you're welcome to type it in the chat as well. All right, hand it over to you, Dr. Paul.
Hi, good morning. My name is Dr. Paul Cachola. I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey. And today we're going to touch on shoulder mobility drills for tennis players. So let me get up my slides here, get this started. Basically, because I am a physical therapist, a medical provider, I have to put up my little disclaimer that what we're going to go over today is very valuable information to improve your shoulder mobility and decrease pain and injury while playing tennis. But it is general information. So if you are dealing with a specific ache or pain or problem or diagnosis, please seek professional help from a medical professional. All right, so let's dive into it. If you've been to my other courses in the past, you know that this is the one thing I always start with, that the body functions on an alternating pattern of stability and mobility. If that pattern is disrupted, then pain or injury is the result. So let me show you a little video here. So this alternating pattern of mobility and stability starts at the ankle. The foot needs to be stable, the ankle needs to be mobile, and it goes all the way up to the body. Every other joint is stable and mobile. Let me see if I could fast forward into my next slide. There it is. So this is what we deal with. So if somebody has an injury at their shoulder, you could see that the shoulder is supposed to be a mobile segment. If you have an injury or a pain and you've lost mobility, then your body will try and make up that mobility elsewhere. And the next segments above or below that is going to be the elbow or the shoulder blade or the scapula. So those are things that we have to look at also when dealing with shoulder pain, because pain is just a symptom. It's not a diagnosis. It tells us that something's wrong, but it doesn't tell us where that problem is. All right, so moving forward, let's look at the shoulder joint itself. The shoulder is comprised of these four joints. The sternoclavicular joint, that's where your collarbone meets your rib cage, and then the AC joint, where your collarbone meets your shoulder blade in the back. You have the glenohumeral joint, which is basically our classic ball and socket, and then the scapulothoracic. That's the shoulder blade moving on the ribs. Now, if you can see in this picture here, the glenohumeral joint, the ball, is not a very round ball. It's got a big, large bump on the outside, and that acromioclavicular joint creates a little bit of a roof, and we're going to be talking about that later on and why that's important if you have shoulder issues. So I'm going to show you a little video about how the shoulder moves and what happens to the rotator cuff if it gets impinged. So the shoulder blade has to rotate up as you go overhead, and then that little roof and that big bump that I showed you earlier, if those two bony parts come in contact, then you get irritation to the tendon, and that can cause pain and injury. So let's move forward. When it comes to tennis, the overhead, the serve is probably the most where people get injured. Now, if we look at the setup here, the sequence of photos from 1 to 8, we look at what the position is of the arm, especially at number 4. So at number 4, we're in this position where the shoulder, the elbow is away from the body, and this hand is rotated back to really cock and deliver that racket to the ball. Now, if we go through the sequence here, if we go to number 7, we have this position where the hand is across the body and the thumb is kind of turned down. All right, depending upon where that elbow and hand wind up in this position can create injury or pain in the shoulder. Let's take a closer look at another overhead smash here. So Number 5, the picture number 5 here, is this ending position as the hand has turned down, the elbow is high, and the hand is low. So that is called internal rotation. We have external rotation where the shoulder has rotated back, and then we have internal rotation where the shoulder rotates forward. Now, that ball and that socket that we talked about earlier, that bump can come up right up against the top of the socket when you go into internal rotation, especially when that elbow is high. So depending upon what your position is, let's kind of wind it backwards here. If we go into the overhead position, the number 7, if we come into this internally rotated position and the elbow is slightly lower than the shoulder, then there's more room in the joint to create that internal rotation. But if the elbow is high, like in this next position here, and then I try and rotate down, that's going to create, that's less space in the joint, and that causes more of that impingement and then trauma to the rotator cuff tendon. So you can imagine like how many serves that you do during a game, or how many overhead movements, depending upon your technique and your body position, you can create a lot of stress onto that joint. Now let's talk about the other strokes. This is a forehand, and number 3 and 4 here, you can see the position of the shoulder, and it's in that externally rotated position, but the elbow is close. So we have external rotation at top end with your serve, and then the forehand where the external rotation occurs more at that neutral, close to the body position. And then we have 2 types of backhand. So we have the backhand that's a double-handed, and then we have a single. So what's common to these 2 strokes is thoracic rotation. So when we're trying to do this backhand, we definitely want to have enough thoracic rotation or mid-back or torso rotation to occur so that you can deliver this club versus this hand coming right across the body. So again, when we're going across the body, that can cause a lot of issues in the front part of your shoulder with just kind of coming across and opening up this position versus trying to rotate the body and then opening the trunk and then the hand. So it functions as a kinematic sequence. All right. Shoulder mobility includes thoracic mobility. What does that mean? That means that your shoulder, because of that scapulothoracic joint that we talked about, the shoulder blade moves on your thoracic spine, your rib cage. So if we want to improve shoulder, I'll show you on my other arm, if we want to improve shoulder range of motion, we have to also improve our thoracic range of motion. So you can imagine here, I'm going to try and set myself up, that if I round out my back and I'm hunched over and I try and raise my arm up, you can try this on your own at home, I can only bring my arm this far because I've run out of room inside the joint. But if I take my mid back and I open my back up, I get a lot more range of motion. So when we treat shoulder issues, we always want to treat the thoracic spine as well. All right, so a couple of things that we're going to go over today is improving that shoulder external rotation and flexion, which is overhead motion, and then thoracic mid-back rotation and extension. So we could be able, basically be able to go overhead with our tennis stroke or our overhead serve, or rotate a backhand or forehand with the thoracic rotation. All right, so I'm going to move this out of the way and then get into my regular camera here. So we'll talk about some things, some exercises and some stretches that we're going to do. If I can take my camera back, I'm going to grab my racket. So the first thing is that we want to be able to rotate through the thoracic spine, right? The thoracic spine needs to extend and it needs to rotate. So one exercise that we can do, actually I can put this down and tilt this down all the way because we're going to start on the ground. Move that out of the way. We're going to do this exercise called an open book. Now the open book exercise is a good stretch for getting the shoulder, the thoracic spine, the mid back to rotate. You're going to lie down on your side. And the big thing with the thoracic spine and getting that to rotate is making sure that when we do this stretch, that we do not cheat and rotate through the lower back. So the lower back is very it's very good at compensating and rotating when it shouldn't. So to lock out our lower back from rotating, we bring the knees up as high as we can, right? So keeping the knees up, that flexes the lower back and locks out the lower back, the lumbar spine. This bottom hand, my left hand, is going to go on top of my knees, so I'm not going to let my knees move. And this top hand, my right hand, is going to come out in front, and I relatively rotate my torso to my left, to the ground, and I'm going to take that up and back and try and rotate as far back as I can, not letting my knees rotate or knees move. So I'm just going to kind of go back and forth like this, opening the book. That's what we call it, the open book exercise. And there's a couple other ways to do this. So this is just one example. Another one is to pair rotation with flexion. So that means that we're going to go into this child's pose position. I have my one hand out in front, and I'm going to take my opposite hand and just thread that underneath. This is called thread the needle. So I can kind of do rotating to the left or to the right with my left hand and rotating to the left with my right hand. I'm just passing it underneath this space between my armpit, my rib cage, and my knees, just kind of rotating back, taking my left shoulder to the ground. I could repeat on the other side, taking my right shoulder to the ground. So we're creating rotation in those two different positions. Now I'm going to raise this up a bit. We could also do rotation in a different position, in this half kneeling position. So in this half kneeling position here, I can rotate over the lead leg. Let's do it with my right leg out in front. And we can think about being nice and tall. The hands can be across the chest here or behind the head, doesn't really matter. If you just give yourself a big hug here, we could go into this half kneeling position and rotate towards the same side, that's the knees in front. So I've got my right knee in front. I'm going to keep that knee nice and still, and then I'm going to rotate over that side repeatedly. So I'm rotating my thoracic spine to the right, my mid back to the right, as I'm keeping this knee still. We don't want the knee to move, because again, our body is very good at going through the path of least resistance. So if we're tight in the thoracic spine, what's going to happen is that the knee is going to kind of go out like this, and then I lose that rotation that's going to be specific for my thoracic, and it's going to come out of my lumbar, my lower back. So as you try and rotate, we want to try and use the muscles, use the abdominals to kind of rotate just the upper body. The knee stays still. In this position, it's a little bit tricky. It's a little bit challenging because in this half kneeling position, we have to be stable in the lower half of our body. The glute, the butt muscle on the back here, my right leg, has to be on to maintain this balance, this position, so that I can be mobile up top, right? So a couple of these exercises, as we're moving through these motions, you don't have to kind of hold it. It's really just going through the end range, feeling how far you can go, and then coming out and then doing that for about a minute or so. All right, so another thing that we'll go into is specifically for your shoulder. So I'm going to bring this back up. So if you're at your tennis courts and you're going to go play, one easy way we think about the positions that the hand needs to be in or the shoulder needs to be in for our strokes. This is that flexion and external rotation at this position and external rotation at this position. So we could take the racket. I'm just going to put my hand on top of the racket, get my elbow out to the side, and I'm going to push that racket back repeatedly. Again, we can go through this motion just back and forth, going into that end range, feeling that tightness, and then going for about a minute, trying to increase that external rotation. All right, and I could do the same thing at neutral, keep my elbow by the side, and I'm just going to push that out. The main thing is, as we do this, we don't want to cheat with the elbow, so I'm going to keep my hand and my wrist and my elbow parallel to each other, or at the same height. We're not going down like this, right? So the body, again, is really good at making these compensations and going through a range of motion that's the path of least resistance. So if you're tight in these directions, you have to be really strict with how you're rotating, because it's easy to do this. Same thing over here. As we're rotating back, if you're really tight, it's easy to just kind of just open up the elbow, all right? So that's all elbow motion. That's not shoulder motion. Right? So again, constant motion, kind of pushing it back and forth. And these are good things to do prior to your game or to your match, because you don't want to do static stretching prior to any athletic activity. We want to do dynamic stretching, where we're moving through a range of motion and then kind of increasing that tissue elasticity and joint motion gradually. Anything that you're holding for a prolonged period of time, like 30 seconds for a classic stretch, lengthens the tissue and also reduces its ability to create force or create power, especially if you're going to try and play a sport. All right, so another one I like to do is just anything overhead. I'm just going to grab a stick over here. And you could use a wall or anything like that. If you're facing a wall or a fence, if you're at the tennis court, we're basically going to fix the hands there about shoulder height. So I'm going to put my hands right on top of this stick here, and it's about shoulder height. And then I'm just going to relax and bring my hips back and my chest down through my arms. So it looks like this. So as I go down, my hips are going back. I'm keeping my back straight, and then I relatively am bringing my shoulders, my arms overhead. Okay, so again, it's going to be a constant motion going through the range of motion repeatedly for about a minute. All right, so hopefully those things are going to be helpful in warming you up for the tennis game. Oh, we got some questions here. Yes, I think that was John Eisner serving. Right off the internet, I just looked it up. All right, is the recording available? I don't know. I think there may be. Christina, is there going to be a recording of this after our little talk today?
Yes. That's a yes, Dr. Paul.
All right, awesome. Any other questions about shoulder issues with tennis or any other sport?
Yes, Dr. Paul, as I mentioned to you earlier, this is Delia. Would the exercises that you just showed help with loosening up the shoulder encapsulation or the frozen shoulder?
They can. I mean, the big thing with frozen shoulder is that it is I guess, the adhesive capsulitis, basically.
Right.
Thickening of the capsule, this connective tissue sac that's holding the ball together in the socket. So depending upon where you are in your journey of recovery, these exercises can help because we're working on thoracic and shoulder range of motion. The key thing is that if you're dealing with a specific issue, is that none of these things should hurt. They should not give you pain. You might have a little bit of discomfort at the end ranges of motion, but you should not feel worse after you complete the exercise.
Yeah, I actually don't feel any pain with it. It's just that I have limited range of motion. So I'm about 75%, 80% of my range of motion right now.
Excellent. There's another question here. How about tennis elbow? So tennis elbow is generally classified as a pain that is on the outside of the elbow. I find it is super stubborn to get rid of that once that pain starts to get really localized at the elbow joint. It's usually worse with gripping, with wrist extension, like this position here. If we hold that position, that tends to be painful. I'll light up that shoulder. It's worse with backhands. It's worse with like turning doors and stuff like that. So typically, I feel that people get this elbow pain because of something else that's going on in their shoulder or their trunk. It's a technique problem, or if it's a mobility problem somewhere else, like we talked about that alternating pattern of stability and mobility. But if you're dealing with elbow issues, the first thing that we can do is try and break up some of those adhesions inside that muscle tissue by taking your fingers, coming from the lateral side of your elbow, and then going across that. And again, you can apply as much pressure as you can tolerate, but don't go crazy to create any pain. 2 minutes max. And then we start to do that stretch. So this is a classic stretch that kind of brings the fingers down. You're kind of just keeping your elbow straight and then holding this for 30 seconds. Now, after that, if we are able to control the symptoms, then we work into strengthening that tendon, and that involves eccentric exercises with weights, with a dumbbell or a band or something like that.
One more, you have one more question, Dr. Paul, if you have time to answer that one. From Leopoldo, if I'm pressed for time, which stretch would be the best one to do prior to playing?
All right, so we got to do a combo maneuver. Show you this and grab my got my tennis racket, right? So let's think about like, what am I going to do to improve mobility right before? We got like 2 minutes to do prior to your match. You're going to get into this half kneeling position, right? So we talked about this half kneeling position with the rotation. You're going to add that rotation with shoulder flexion. We're going to take this up and across, up and across. So I'm going to face you and show you on my my serving side, right? My right arm is going to be up in front, that half kneeling position. So that opens up my hip, right? This lead hip in the front, and then also gets thoracic rotation and shoulder flexion at the same time. So this is a combo maneuver. It's not for the beginners, right? There's a lot of things moving on here, and then we can start to do rotation and standing, kind of moving the feet as well, and then doing the classic across the body stretch as we do the rotation. So I'm taking my hand and then coming across and then moving into the ranges. And then we can kind of just do easy swings with the racket as well.